Hello, cat enthusiasts. This is Dr. Kara Caldwell, and I've been a feline-only veterinarian since 2011 in the state of Connecticut. Today, I'm going to talk about what to expect when your cat goes to the vet and what we're doing when we're using all those crazy instruments. We'll also talk about how to make your cat's visit go more smoothly, ways to prep them before they even get there. And of course, you can always reference my video that's already up that talks about how to get them into the carrier. So let's get started. First piece of advice is to bring your cat's favorite toy, towel, or blanket. Having the vet office smell like home can make a big difference in your cat's comfort during the exam. If you can, have your cat come hungry and bring their favorite treats with them. This will serve two purposes. Some tests require fasting or are more accurate fasted, such as certain gastrointestinal blood tests and x-rays. The other purpose is the vet team can use treats as a distraction if your pet is very food motivated. This strategy will, of course, be more successful if they're hungry. If they just ate a big meal, trying to offer them a treat may not work quite as well. Use an appropriate carrier. Ones that are hard-sided, top opening, and covered with a towel are ideal. Because not only getting them to the vet is an issue, but also getting them back out of the carrier can be an issue when they're nervous. So making sure you use a hard one, they have less to grab onto when we're trying to get them out of the carrier, which makes them a little bit less anxious. If this is your cat's first visit to a new vet, tell the vet anything that can be helpful. Things like, my cat's official name is Gregory, but we almost never call him that. We call him Mr. Fluffy Pants at home. By giving us little hints like this, it can help us make your cat feel more relaxed. We'll call your cat Mr. Fluffy Pants too. Your cat will be more familiar with that name, and it will make them feel like we're not strangers. Other helpful hints for the staff may include, he can be scared here, but he likes to be hidden in a towel or blanket. Or things like, he has an old injury on his right leg, and he may not like it if you touch it. This helps tell me I should touch that area last in my exam, as well as see if there's anything I can do to help, as that can indicate chronic pain. If you are a new patient, bring any and all veterinary records you may have. Sometimes there are small hints in them that may have implications later in life, such as if they had certain antibiotics before, we know that they are likely to tolerate them well in the future. Certain things like traumatic sprains due to a fall early in life can lead to arthritis forming later. We will also ensure your cat's vaccines were given appropriately and they were tested for leukemia and feline AIDS at appropriate intervals. Of course, bring a poop sample and a baggie if you can. Vets love poop. At our clinic, we will perform the examination in front of you and discuss our findings as we go so you can see what we see. We will examine the entire mouth, including under the tongue, and the teeth, looking for any signs of dental disease, masses, foreign objects, or swellings. We will look at your cat's face and eyes for symmetry, and the retinas for any changes that may indicate inflammation, certain parasites, or even high blood pressure. We will look into the ears for masses, inflammation, and infection. We take your cat's temperature with an ear thermometer to reduce stress, but we also understand that it's not the most accurate method, and it can vary by about 2 degrees. So if we suspect fever or your cat is ill, we will confirm the temperature with a rectal thermometer. We'll also check your cat for a microchip and make sure if they have one, it's still able to be read by our reader. Next, we will listen to your cat's breathing and heart with the stethoscope. The vet will palpate their abdomen, feeling for any abnormalities, such as small or enlarged organs, constipation, thickened intestines, masses, or pain to help us diagnose conditions as early as possible so we can intervene as needed. We'll also feel the limbs for arthritis and test range of motion and check the skin for scabs, masses, and parasites. While this is not common at many clinics, I'll also check cats new to your house for ringworm with a Woods lamp. Ringworm is a fungus that is a public health concern, as people can get it, and it is spread by hair. Woods lamps, which are basically fancy UV lights, are not gold standard for diagnosing ringworm, but it is not invasive, and I prefer to be thorough when a cat is coming into your house for the first time from a cattery or a shelter. If your cat is having hair loss or there is glowing, I would recommend a culture at that point. Many conditions, if found early, can be helped by things as simple as a diet change, or have intervention done before it becomes an emergency. For example, I have found a few patients now that are lacking one kidney that were confirmed by diagnostic imaging. Knowing this is important because those cats are going to be more predisposed to kidney disease and need to be screened more frequently and at an earlier age. Another patient came in for their routine appointment, and I was able to feel that their stomach was full of foreign material. While we did have to go to surgery to get it out, we were able to do it while he was still stable and had a better chance of a full recovery. He ended up having about 1/4 pound of plastic bags, hair ties, and part of a cat toy in his stomach, but he was still eating and not vomiting. More commonly, I find cats that have dental disease or unexplained weight loss that was not noticed at home, and it might trigger more diagnostics or treatments before the condition becomes severe. If your cat is healthy enough, we will discuss recommended vaccinations with you. For an indoor cat over 1 year of age, this would include rabies and distemper. If your cat is under 1 year of age, lives with an indoor-outdoor cat, you foster cats and kittens of unknown leukemia status regularly, or your cat goes outside, the core vaccinations include rabies, distemper, and feline leukemia. Leukemia has recently been upgraded to a core vaccine for cats under 1 year old due to its efficacy and that young cats are more susceptible to severe disease if exposed. If your young cat is no longer exposed after 1 year old, the vaccine can be discontinued. Speak with your vet for specific recommendations based on your cat's risk and lifestyle. But of course, what even are these diseases? So rabies is an untreatable, incurable virus spread by saliva through bite wounds from infected mammals. Rabies causes neurologic symptoms including seizures, drunken walk, fever, loss of appetite, dull behavior, and aggressive behavior. It can also be spread to humans via bites as well. Rabies is still found in the United States and can be transmitted to indoor animals if a bat carrying the virus flies into the house and your pet interacts with it, or your pet accidentally gets outside and ends up in a fight and is not up to date with the vaccine. Distemper, also known as the feline viral rhinotracheitis calicivirus and panleukopenia (FVRCP) vaccine, is a collection of viruses. Feline viral rhinotracheitis is a virus that causes flu-like symptoms in cats and runny nose and eyes. Calicivirus is another upper respiratory disease that also causes vomiting and diarrhea. Some cats will also develop significant fever and sores in their mouth that prevents them from eating with calicivirus. Feline panleukopenia is a potentially deadly virus that infects the bone marrow and causes cats to not be able to mount responses to illness due to severe reduction in their immune system. It also causes severe vomiting and diarrhea and carries a 90% death rate in kittens and a 50% death rate in adults. All of these viruses are highly contagious, both directly and indirectly, with people being able to transmit the viruses to their indoor pets on their clothing and shoes. Leukemia virus is a retrovirus, meaning it incorporates itself into the genome of the cat and may not be cleared. It is spread by close contact with another infected cat via saliva, urine, grooming, sharing food and water bowls, bite wounds, or a kitten may get it from its mother. There is no known treatment for feline leukemia that is effective. Typically, we can only treat symptoms as they come, and the median survival time after diagnosis is about 2.5 years. Non-core vaccines, which means a vaccine that's not recommended for every cat, may include chlamydia, bordetella or kennel cough, or feline infectious peritonitis. For a thorough look at vaccinations and timing, please refer to the American Animal Hospital Association.org's website, aaha.org/feline vaccination. We may also discuss as part of the exam screening blood work, deworming, and heartworm or parasite prevention. Screening blood work is annual blood work that helps us know what your individual cat's normal is. For example, some cats have slightly no neutrophils, a white blood cell, normally, but that can also happen due to several diseases. Without having blood work done while your pet is seemingly healthy, we may not know if that is normal for your cat, and it may lead us down a different path when your cat is sick. Regular blood work can also help us see trends before your cat has outward signs so we can intervene early. An example of this is if we see your cat's kidney values start to increase. It may indicate early dysfunction, and we may recommend coming in more frequently for additional diagnostics, such as a urine sample, to rule out things like urinary tract infections, dehydration, or other reasons that this may be happening. Yearly exams are important for every cat, even if they seem well at home. A trained veterinarian can find things early and save your cat pain, stress, and potentially save you money if we are able to intervene early. Preparing your cat and paperwork for their vet visit is helpful for the vet team and can help your cat have a more pleasant visit and experience. What has your vet found on an exam that you were not expecting? Leave a comment below. I would love to read some of the stories you may have. Like and subscribe for more videos on tips and tricks for getting your cat to have a better time at the vet and ways to help keep your cat healthy at home.